women in Malaysia don't necessarily have the correct information about breast cancer.
Yes.
So many women in Malaysia get very confused, because nowadays with breast cancer is not one disease. Breast cancer is at the genetic level. We know that it's at least 10 different types of diseases, all of which we call breast cancer. But the first type of breast cancer might need one type of treatment, second type of breast cancer might need a separate type of treatment, and so on. So there are different types of treatment for different patients, and there are different types of treatment for different cancers. So to try and understand all of this is actually going to be very difficult. And then on top of that, they need to make decisions like, will I lose my breast, body image issues, and then they also have psychosocial issues with relationships. Am I going to lose my husband? Am I going to be disowned by the family because of the stigma associated with cancer, and so on? So what we decided, and then their financial, can I afford treatment? Will I go bankrupt? Am I going to lose my house? Am I going to put all of my savings into treatment? Am I going to lose my job because I need to take time out for treatment, and so on? So all of these considerations make it a very confusing time.
Complementary or alternative medicine, because that comes out very strongly. So I actually did a study on why women present with advanced cancer. So we do find that having alternative therapy so strongly embedded in our society, that really makes it very confusing for the woman. In UM, there was a study we looked at women who did, whether they completed therapy. So 7% of our patients actually did not complete their therapies, may have disappeared for a while and come back later. But I suspect in other parts of the country, like especially in the northern states, because there are publications to show that about 50% of the women there present with stage 3 and 4 breast cancer. So, in our hospital, it's about 15%.
So sometimes patients focus on the side effects and not actually on the efficacy. So in other words, they focus on, okay, if I take alternative, I'm not going to lose my hair. They don't think about this alternative may not work. And very often they're given anecdotal stories of a treatment that may have worked in another patient. But most of the anecdotal stories may not actually have been cancer, because it could just have been a lump. There was a cyst, maybe a fluid-filled cyst or something like that, that could have been treated with complementary medicine that had some steroids in it, or some thing that modifies the hormonal status, and therefore the cyst or the fluid-filled lump went away, but it was never cancer to begin with. So I think it's very dangerous to do that.
The belief in the society is that if you have a biopsy, it will spread. So they will not have the biopsy, and then when they go to the alternative practitioner, they will tell them, tak boleh kena besi, because you cannot have any metal,
to cut into the flesh.
So this is a direct alternative therapy which negates, like hospital treatments, and this is a strong belief in the society. So I think a lot more effort should be taken to, number one, educate, number two, to control the alternative therapies, because if we could register alternative therapies in this country based on evidence, so that we don't provide misinformation to the patients.
Late presentation alone is not the only factor, and there are other reasons why Malays are less likely to survive breast cancer. So Malays have a lower risk of breast cancer. They have half the risk of breast cancer compared to Chinese, but when they get breast cancer, they're more likely to die of it than a Chinese is.
Because the community believes that, even when you say cancer is the big C, so people have very fatalistic connotations to cancer, and they don't realize that breast cancer, especially if it's pre-cancer stage 0, is almost 100% survival from this disease. And if it's stage 1, it's beyond 95% survival. And if it's stage 2, it's beyond 85% survival. Even stage 3 breast cancer is about 50%. And stage 4, of course, is much less than, we usually quote the figure about 10%, because there are people who have stage 4 breast cancer and they're still alive today in long duration of time. So I think that part is something that somehow the community has not embraced. If you go to the West, our role models are Kylie Minogue, someone who's had treatment, surgery and everything, and went back to a world tour after her cancer. Or even Angelina Jolie not even having cancer, she can get back to her normal lives, making decisions like that. But in our community, I think the role models, because our role models are usually someone who's got metastatic breast cancer, presenting late, having multiple therapies, progressing after every chemo. So the woman does not recognize who are the ones who got the early breast cancer. So that's why the survivor groups like Breast Cancer Welfare Association, these women, those who have survived 20 years, they actually give hope to women. So I think we should change the mindset of the community first to say that this is treatable. You've got to stomach a little bit of the side effects of the therapies, but you can survive this. And basically empowering women, I think that they can actually go through the treatments.